Hello, Assalamu alaikum. I am Dr. Misbahul. Today I will show you the anatomy of the heart. This is a 3D model of human body. Look very carefully. Your heart located at left side of your chest. If we remove the skin, then the next layer of your chest is the pectoral fascia, and if we remove the pectoral fascia, the pectoralis major muscle will exposed. This is the pectoralis major muscle. If we remove the pectoralis major muscle, then some muscles and ribs are exposed. This is the clavipectoral fascia. We remove it. This is the pectoralis minor muscle. We remove it. Then these muscles are external intercostal muscle. We also remove this. Now this muscle is the internal intercostal muscle. We'll also remove this, and then we gradually remove the ribs, the second rib, the third rib, the fourth rib, and the fifth rib. This muscle is the external abdominal oblique muscle. External abdominal oblique muscle. We also remove this. Then we can clearly see the lungs. This is the costal part of the pleura overlying the lungs. Look very carefully. The glossy appearance. We remove the innermost intercostal muscle. Now the pleura has been exposed. We remove the costal part of pleura. Then the visceral pleura of left lung has been exposed. If we remove the visceral part of pleura, then the lungs superior lobe of the left lung has been exposed. If we remove the superior lobe of left lung, then see, we can see the beating hearts. This is the heart. The membrane of the heart is called the pericardium. This is the fibrous pericardium. Now look the pericardium. This is the envelopes of the heart. If we remove the envelope of the heart, then the next layer of the heart is the parietal layer of serous pericardium. This is the parietal layer of serous pericardium. We also remove this. Now the visceral layer of serous pericardium has been exposed. We also remove this. Now this is the epicardial adipose tissue. To expose the heart more clearly, we should remove the sternum. This is sternum. We remove it. We should remove the ribs and costal cartilage. We should remove the transversus thoracic muscle. And now the heart is more clearly visible. The heart with its great vessels. Now we remove the epicardial adipose tissue. Now this is the anterolateral wall of right ventricle. This is the posterolateral wall of left ventricle. This is the wall of right ventricle. Look, this is the wall of the right ventricle. This is the left ventricle. This is the atrioventricular foramen. This is the atrioventricular foramen of right side. This is the atrioventricular foramen of left side. This is the pulmonary trunk, and this structure is the aorta. Now this is the wall of the anterolateral wall of the right ventricle. We should remove the structures one by one. The pectoral fascia, the pectoralis major muscle, the costal cartilages, the radiate sternocondral ligaments, the transversus thoracic muscle, the external intercostal membrane, the external intercostal muscles, the internal intercostal muscles, and also the costal part of right pleura, visceral pleura of right lung, the superior lobe of right lung we remove, then middle lobe of right lung, then the heart is more clearly visible. This is the heart. This is the thymus gland. So this is the position of the heart in human body. I hope this video will help you. Thanks for watching. Please subscribe my channel and do share. Assalamu alaikum.